Sup, chooms, how y'all living? Hope everything is Nova and you're all having a preem week. So, when it comes to fighting the good fight against hair loss, the best course of action anyone can take would be to begin a pharmaceutical intervention before androgenic alopecia even has the chance to progress. So, even though there are some tests in development at the moment, there are, as of today, no practical ways to determine whether or not an individual has the androgenic alopecia gene before it actually starts expressing itself with hair loss. You can determine the possibility of a gene's incidence based on family history, since it is, after all, a genetic trait, but just because you don't see any family history of hair loss does not necessarily mean that the androgenic alopecia gene won't eventually rear its ugly head and doom you to a lifetime of being left swiped on Tinder. Getting on finasteride or finasteride plus minoxidil before you have any signs of hair loss is the golden option, because even though these treatments do have a good chance of helping you regrow some hair you've lost, they are mostly good at just maintenance as well as preventing future hair loss. So waiting until you've lost ground is a poor strategy for tackling hair loss, so it's best to get on treatment beforehand, because there is no guarantee that what you've lost will grow back with just drugs. Sadly, most of us didn't have this kind of hindsight, and that includes myself. The fact is, though, is that most people who begin treatment will begin treatment only once they've already lost ground, and sometimes even a substantial amount of ground. For me, a lot of my hesitation about starting finasteride stemmed from the fear-mongering I read about the drug online, and that prevented me from using the drug consistently until I was well into Norwood 3 territory, and arguably, I was even bordering on being a Norwood 4. So, when it comes to hair recovery, drugs can help, but they can only recover so much lost ground. That is where hair transplants come in. The medical science behind hair transplants was established by Dr. Orentreich in 1959, so hair transplant surgery predates even pharmaceutical interventions as a hair restoration method, and even though there are some bad clinics and hair mills that operate today, getting a hair transplant today from a quality doctor is to date the best way to recover hair that is too far gone to respond to pharmaceutical interventions. Sadly, though, as good as hair transplants have become since they were first introduced, they have some limitations that cannot be overcome no matter how good of a hair transplant surgeon you find. Notably, donor areas are limited by the amount of hair in the back and sides of the scalp where the hair is more resistant to damage from DHT, dihydrotestosterone. There are doctors who specialize in extracting grafts from other parts of the body to compensate for the lack of donor area hair grafts, and a good example of this would be Dr. Umar from California, but these body hair grafts do not have the same texture as scalp hair, and they don't grow as long, so it forces recipients to keep their hair short if they elect this option. So why can't we have an infinite supply of donor hair from the donor region? Most conservative estimates suggest that doctors can only transplant 6,000 or so grafts total, although this number can vary from patient to patient depending on the quality of the donor region. Well, the reason the donor area is finite is because when hair is extracted from the scalp, whether it be from the strip method used in an FUT transplant or the individual extraction method used in an FUE, what will be left over after the surgery is scar tissue. This scar tissue replaces the normal skin that has hair follicles, and unfortunately, once the normal skin along with its hair follicles is gone, it's gone for good. So, this limitation really sets boundaries on people seeking hair transplants, especially people who are very far gone, such as people who are Norwood 4s or greater. Keep in mind, even fixing just a Norwood 3 can easily cost over 2,000 hair grafts. So, other than body hair transplants, which are flawed, is there any means of restoring donor hair so that hair transplant patients will be able to have as many hair transplants as needed without depleting the donor area? The big question is there any way to heal up donor areas so that they can once again grow hair instead of just being transformed into ugly scar tissue? So, to answer this question, we have to first look into what causes scar tissue in general. We know that when the skin is wounded, it triggers a healing process in the body, which ends up with the formation of scar tissue through a process called fibrosis. Scar tissue is not like normal skin. It is largely avascular, it is denser and less flexible, and most importantly, it lacks normal skin features like sebaceous glands and hair follicles. Some people actually get excessive scar tissue after wounds, and these are called hypertrophic scars or keloids keloid scars, which look puffy and more cosmetically displeasing than regular scars. So scar tissue is caused by a certain kind of cells called fibroblasts. There are different kinds of fibroblasts, but the ones that actually cause scar tissue have a gene that is activated that is called engrailed-1. Fibroblasts with this activated engrailed-1 gene cause the formation of collagen, which is the tough tissue that's seen in scars, as well as a bogus new age supplement for mommy bloggers and other impressionable primal-brained morons. So, back in April of this year, there was a study published in Science magazine that looked at if there was a way to prevent scar tissue from forming after injury. This was a study that was performed in mice, and there are a lot of details that aren't really important to go over, so let's just summarize what they did in this particular study. So, in this study, the researchers created wounds in the mice, and then they looked at the fibroblasts that formed during wound healing. The researchers looked at the fibroblasts that had the engrailed-1 gene activated and the fibroblasts that did not have the engrailed-1 gene activated. What the researchers found was that as the wounds on the mice healed, there was a mechanical tension formed on the skin of the mice, and that this mechanical tension actually caused the fibroblasts to activate the engrailed-1 gene and thus turn into fibroblasts that created collagen. Since collagen is very dense tissue, this caused the skin tension to get even greater, and the greater the skin tension, the more fibroblasts with the engrailed-1 gene were formed. So this was kind of like a vicious cycle for the mice. So anyways, the wounds ended up healing with the very dense scar tissue instead of normal healthy skin. So the researchers then wondered if there was a way they could break this wound healing cycle and make it so that healthy skin with hair follicles would take the place of the scar tissue. So in order to test this hypothesis, the first thing the researchers did was they bred some mice that lacked the engrailed-1 gene and caused wounds in those mice. Amazingly, these wounds healed up just fine, but they healed up with normal healthy skin that included hair follicles rather than scar tissue as we'd normally expect. You can see the difference in the wound healing in this figure, where on the bottom left, you see just a hunk of gray scar tissue when the engrailed-1 gene is activated, and on the bottom right, you see that if the engrailed-1 gene is blocked or eliminated, normal skin with normal hair follicles is restored after wound healing. So the researchers then asked themselves if there was any drug they could use which could block the activation of the engrailed-1 gene, which seems to be the culprit in the formation of scar tissue. So, as it turns out, there is a drug that is already FDA approved for a different purpose which may just do this, and it's called Verteporfin. Verteporfin is currently an FDA-approved treatment for the treatment of macular degeneration of the eyes, which is caused by the proliferation of blood vessels in the retina that is triggered off by exposure to light. Verteporfin prevents this from happening, but it has also been tested out as a treatment for fibrosis in the lungs, as well as fibrosis, which leads to what is called Dupuytren's contractions in the hands, which is a condition where you can't straighten out your fingers due to scar tissue which is present on the tendons of your hands. It's also been looked at as a possible treatment for Peyronie's disease, which is when scar tissue forms in the penis, causing a greater than normal degree of curvature. So the data suggests that verteporfin has some effect in preventing scar tissue formation, so the researchers then decided to see if it would have replicable results in these mice with wounds on their skin. The researchers had some theoretical reasons to look at verteporfin as well. It turns out that the expression of the engrailed-1 gene is caused by what's called the YES-associated protein, abbreviated as YAP, YAP. If you block this YAP protein, theoretically, you will not get this expression of the engrailed-1 gene. Well, I have some good news, chooms, because verteporfin is in fact an inhibitor of the YAP protein, as you can see in this diagram. Verteporfin blocks the YAP protein and prevents the transcription of engrailed-1, and so it breaks this vicious cycle that causes the formation of scar tissue. So indeed, when the researchers gave verteporfin to the mice, the wounds healed with normal skin and normal hair, and there was no scar tissue formed. In this figure, you can see that the characteristics of the verteporfin in blue are the same as the unwounded skin in green, and quite different from a normal wound, which is in red. This means that in theory, verteporfin would prevent scar tissue from forming, meaning that it's possible wounds caused from hair transplants would heal back just as regular skin, and that includes hair follicles rather than scar tissue, which would thus give hair transplant patients an unlimited amount of donor hair, thus eliminating a huge limitation of this procedure. Of course, it's important to remember that the activation of this drug is contingent on wounding, so it may not be viable as a conventional hair growth treatment, though since we do know that fibrosis does occur with androgenetic alopecia, it is possible that it might have an effect in perhaps slowing down the process of androgenetic alopecia, which may make this an effective hair loss treatment by itself, even independent of its benefits with hair restoration surgery. This is very speculative, of course, as no studies have been done as it pertains to just treating androgenetic alopecia alone, but I do think the theory is sound enough that it warrants further research. What we really need to see how good and promising this thing is are some human studies, but since it already is an FDA-approved drug, I think there is a high probability we'll see some research on this soon in humans. So, at the very least, this may be a good way to prevent the loss of donor hair after a transplant, which itself would be really amazing. Although keep in mind, this treatment will not restore hair on tissue where the scar tissue has already been formed. So if you've already had a hair transplant, then this treatment will not help you recover any donor area, but it may be a good way to prevent you from losing any further donor area during future hair transplants. So even though I always encourage my viewers to show skepticism towards any new unproven modalities at treating hair loss, I think the theory behind Verteporfin is promising, and while it certainly cannot replace conventional hair loss treatments like finasteride, it may very well reduce some of the limitations that come with hair restoration surgery, and possibly may even help as a preventative measure against the progression of androgenetic alopecia in general. So keep an eye on this one, Chooms, and let's see what comes of this. And with that, I'm out. Good luck on the path, my fellow hair loss witchers. Take care.